Imagine you are on a luxury cruise ship surrounded by nothing but the endless ocean. The air feels fresh, the journey feels perfect, and life seems beautiful. But somewhere on that ship, an invisible killer has already begun its deadly journey. One passenger falls sick, then another. This is not fiction, this is not a movie, this is Hantavirus. Hello everyone, welcome back to this channel. Today we are going to uncover one of the most dangerous yet least talked about viruses in the world, hantavirus. What is it? How does it spread? Why are health authorities across multiple countries on alert? And most importantly, should we be worried? Hantavirus is not just one virus, it is actually a family of viruses carried naturally by rodents, especially rats, mice, and other wild rodents. Hantaviruses are a group of rodent-borne viruses that can cause severe disease in humans. The virus gets its name from the Hantan River, where it was first identified in the 1970s. According to the World Health Organization, more than 20 medically important hantavirus species have been identified worldwide. Cases have been reported across Asia, Europe, North America, South America. Hantavirus species circulate globally with different strains causing disease in different regions. This virus usually does not come from other humans, it comes from rodents, more specifically their urine, their saliva, and their droppings. When these dry out, tiny virus containing particles can become airborne, and the moment a person breathes them in, the infection may begin. Human infection usually occurs through contact with rodent urine, droppings, saliva, or contaminated dust particles. The people most at risk include farmers, forest workers, warehouse workers, campers, travelers, and anyone cleaning old rodent-infested buildings. Many cases are reported from rural areas, farms, forests, and isolated cabins. Exposure risk increases during farming, forestry work, or cleaning enclosed rodent-infested spaces. At first, hantavirus may look like ordinary flu, nothing unusual, nothing alarming, until suddenly the lungs begin filling with fluid, breathing becomes difficult, blood pressure drops, and organs may begin to fail. Symptoms often begin like flu, then may rapidly progress to respiratory distress, shock, or kidney failure depending on the strain. Hantavirus can cause two major illnesses. 1. Hantavirus cardiopulmonary syndrome. Mostly found in the Americas, it attacks the lungs and the heart. In severe cases, mortality can reach nearly 50%. HCPS in the Americas can have case fatality rates up to 50%. 2. Hemorrhagic fever with renal syndrome. Most common in Europe and Asia, this form mainly attacks the blood vessels and the kidneys. It may cause internal bleeding, low blood pressure, and acute kidney failure. HFRS primarily affects blood vessels and kidneys and is more common in Europe and Asia. In 2026, the world suddenly turned its attention to the expedition vessel MV Hondias. Passengers began showing mysterious symptoms, several became critically ill, and tragically multiple deaths were reported. WHO reported a hantavirus cluster linked to MV Hondias involving multiple cases and deaths, while assessing global public risk as low. Scientists discovered that this outbreak involved Hantavirus, a rare hantavirus strain found mainly in Argentina, Chile, and unlike most hantaviruses, this one can spread human to human, and this virus is the only hantavirus known to cause limited human to human transmission among close contacts. Doctors usually confirm the infection using advanced laboratory testing, including PCR testing, polymerase chain reaction. This technique detects the genetic material of the virus and can amplify tiny fragments of viral RNA into millions of detectable copies. Unfortunately, there is currently no specific cure, there is no widely available vaccine. Treatment mainly focuses on keeping the patient alive, including oxygen therapy, intensive care, mechanical ventilation, fluid management, kidney support, including dialysis in severe cases. There is no licensed specific antiviral treatment or vaccine. Early supportive care improves survival. Health experts recommend avoid rodent-infested places, seal cracks in buildings, store food properly, never dry sweep rodent droppings, disinfect contaminated areas first, wear gloves and masks while cleaning. WHO recommends rodent control, safe cleaning, and avoiding dry sweeping or vacuuming contaminated droppings. Antivirus does not spread through crowds, it does not announce its arrival, it hides in silence, in dust, in forgotten places, and sometimes even in the middle of the ocean. If you found this video informative, subscribe, share it with others, and stay informed, because sometimes knowledge doesn't just educate us, it saves lives.